Hello, everyone, and thanks for listening. So, I was looking at this and I thought this was really, really important because of all of the issues surrounding the CDC and that CDC worker, the young man who was killed, or, well, they said that there was no foul play, so they say, and that there's a possible theories that he may have been trying to warn people about different things that were to come. Well, we have another expert that is warning about the flu. And recently, a lot of people were really up in arms about the flu because the flu this past season, and still for some people, has been really, 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 really dangerous and lethal to where children have died, people, grown people have died of the flu. When have we ever heard of that? Well, in this article, it explains in the New York Post, it talks about the flu becoming a situation where the strain is even stronger than the one we just had, which was we thought pretty bad. So this flu is pretty dangerous. It's actually a killer flu that is labeled a pandemic, and it could be poised to sweep the globe tomorrow, killing as many as 33 million people in its two shift in the flu virus that could wipe out 300 million people. A leading flu expert has warned this. His name is Dr. Jonathan Quick. He's the chair of Global Health Council, and he said the flu virus is the most diabolical, hardest to control, and the fastest spreading potential viral killer known to humankind. Describing what sounds like scenes from a horror film, Quick warned that the Daily Mail of starvation, medicine supplies running low, energy systems crippling under the pressure, and the collapse of the global economy, and what could cause such devastation on a global scale. The most likely culprit will be a new and unprecedentedly deadly mutation of the influenza virus, he said. The conditions are right. It could happen as soon as tomorrow. Flu pandemics happen once in a generation, Professor Robert Dingwall, another flu expert, told The Sun Online. He explained that for a pandemic to happen, there needs to be a dramatic shift in the flu virus, something we can expect to see roughly every 9 to 2 ago, while the deadly Spanish flu pandemic in 1918 claimed up to 1 million lives, infecting a third of the world's population. Pandemic is when we see a shift, a really radical change that means the population has no real resistance to it. And so every year they do this new inoculation where they somehow there's new strains of the viral of influenza. And so here it says it did infect a lot of people, he told The Sun Online, but it wasn't very virulent. So Quick warned potentially that the most dangerous strain of flu is the bird flu, also known as avian flu. And three strains have caused concern in recent years: H5N1, H7N9, and H5N6. Of those, H5N1 poses the greatest of mutating and sparking the next killer pandemic, according to Quick. He said, if a new and highly contagious strain of H5N1 were to evolve and hitchhike with an unwitting passenger onto an airplane, the pandemic situation would quickly assume disaster movie proportions. The strain first infected humans in 1997 during an outbreak in Hong Kong. The bug infected 18 people, killing 6 after the virus jumped from chickens to humans. Over the course of 13 years, from 2003 to 2016, the strain has killed 846 people across 16 countries. Despite the terrifying predictions, Quick said there are measures we can take to ward off this inevitable. The single most vital thing that must be done is to develop a universal flu vaccine. And so this is what I was reading, that they were trying to develop a universal flu vaccine so that everyone would be inoculated in the event this pandemic should occur. So a new vaccine being developed by scientists at the University of California, Los Angeles, hopes to bring us one step closer to that reality. So the experimental drug was found to protect mice from 2 different strains in lab tests. It emerged earlier this year. So the aim is for the universal vaccine to replace the yearly jab, which each year is developed based on predictions, okay, from the World Health Organization. So experts identify or identity of the strains most likely to infect people a year ahead of time, meaning unexpected strains can come out of the woodwork and cause chaos. When it comes to preventing a pandemic, universal vaccine aside, Dingwall warned it can be very difficult once the bug is out there. He said, so flu is very infectious, and there is nothing much you can do to stop it moving about the planet. And so people tried in 2009 with screening at airports, but it doesn't work because people are infectious for around 4 days before they get actual symptoms. So there is a very limiting amount that you can do. There's personal hygiene measures like washing your hands and trying to avoid putting your hands on contaminated surfaces in public places, then in your mouth. But frankly, you're just as likely to catch it from passing a person in a street in the street who sneezed because they're born with the droplets in the air. So, or it carries through the air because of the droplets once a person sneezes. So, Public Health England has repeatedly plugged its Catch It, Bin It, Kill It campaign. So, catch it, bin it, kill it. So there's a campaign apparently in the wake of the Aussie flu and the Japanese flu outbreaks that hit in the UK this winter. So Dr. Paul Cosford, medical director and head of the health protection at PHE, said last week, in order to prevent the spread of flu, it is important to practice good respiratory and hand hygiene and to avoid close contact with others who have flu symptoms or flu-like symptoms. The latest figures showed flu is still proving a problem across the UK, but that infections have peaked, PHE has said. So I thought this is important because you don't hear very many people saying much about it, but the possibility that this last flu may be giving us a sign that something even worse is on its way. And so this was in the New York Post by The Sun, March 6, 2018, and it's in the section of living. Expert warns of potentially catastrophic flu pandemic. So it's not fake news, it's real. And so I just thought this was important because I know a lot of people were complaining about getting sick. I've been seeing a lot of people going to the pharmacies and, at least in the Los Angeles area. And I believe it's even more of a problem when you're in densely populated areas like cities and places where it's more crowds of people, because people sneeze, they cough, and they're touching everything and wiping their nose, and then they have whatever and they've not washed their hands. And so I thought this was something pretty important because there have been some deaths from the previous flu virus that had happened. And I noticed that more I have also realized that they've been stressing that people get flu vaccine um, shots. And so this one that they're looking at or looking into is called a universal vaccine. And so when I hear that and pandemic and that it could be as soon as tomorrow, that, it could surface. The flu is a really big deal lately. And I I pointed to the overpopulation, the way the world is with all the air pollution and, some of the things that are in our food now. They have this big scare about E. coli and Romanian lettuce. I believe it's Romanian lettuce. There's certain vegetables, certain foods that E. coli has come up in. And I know that might be another sickness, but I feel it all ties together because there's so many things that are happening that people tend to not really focus on this. They think flu is just a simple flu. And I noticed that I seen some people saying they found it a lot harder to rid themselves of this year's flu. Well, with that being said, like, comment, subscribe, give me your feedback. There are many lessons to be learned here. Hand washing, good hygiene, you know, being proactive, going right in if you find you have symptoms. Some may not have symptoms in the first 3 to 4 days. So keep on top of their health issues. Like, comment, subscribe. Thanks for listening.